In Appalachia, access isn't just about insurance or clinic hours. It's about geography, transportation, workforce shortages, and the reality that many communities are asked to travel far for basic care. So outreach can't be an occasional initiative. It has to be a reliable system that meets people where they are. I am Dr. Teresa Owens Tyson. I'm a family nurse practitioner, president and CEO of the Health Wagon. The Health Wagon is a nurse practitioner-led mobile health care organization serving rural central Appalachia. I have spent over 30 years helping bring care directly to communities through mobile and integrated models, because the goal isn't simply to deliver services, it's to build trust and continuity where the traditional system doesn't really easily reach. My first point is to start with trust. Show up consistently, not occasionally. The first rule of outreach in Appalachia is consistency builds credibility. People don't engage because you have a flyer. They engage because you're there again, and again. That means predictable routes, familiar faces, and partnerships with organizations people already trust. Schools, faith communities, local leaders, and frontline advocates. When outreach is consistent, healthcare becomes less about getting someone into a system and more about building a relationship that keeps them connected. Point 2, make outreach a full care pathway, not a one-time encounter. Real outreach isn't just a screening event or a single event. The second point is design outreach as a pathway from first touch to follow-up. Mobile care works best when it's integrated. Primary care and prevention, diagnostic access, referral coordination, and follow-up that doesn't collapse the moment the unit drives away. This is where nurse practitioner-led models shine. You're not only treating what's in front of you, you're creating the continuity across complex needs, limited resources, and real-world barriers. Point 3, sustain and scale with smart funding, data, discipline, and the right tech. Outreach becomes sustainable when it's measurable and fundable. That means tracking outcomes that matter. No-shows prevented, chronic conditions stabilized, medication adherence improved, avoidable ER visits reduced, and translating those results into language of payers, grants, and policy. And technology can extend reach, but only when it supports equity. Tools like telehealth, drone delivery for essential medications, and AI-enabled screening or monitoring can help close gaps in remote regions, especially when weather, terrain, and distance disrupt access. In closing, mobilizing healthcare outreach in Appalachia isn't about doing more with less. It's about doing the right things in the right order. Earn trust through consistent presence. Build an integrated care pathway. And sustain the model with outcomes, funding, and equity-minded technology. Because in rural communities, access isn't a concept, it's a promise. And you keep that promise by showing up, staying connected, and building a system that doesn't disappear when people need it most.